folks. I have my friend Dr. Sharon DeMocker here, and she is a physician at the Veterans Hospital in D.C., and I'm going to let her tell you a little bit more about the work she does, because I believe it's what I know is that she's in charge of all of the difficult cases in the whole Eastern Seaboard. So,
right, we're basically the mysterious illnesses team. There's 3 of our teams in the U.S., and I head up the one that's manages the entire Mid-Atlantic and Southeastern. And so we get whatever cases they can't figure out. Certainly, we're not doing a lot of COVID, but since we're kind of stalled on a lot of our consults, then we're focusing now for the VA in general on what the COVID response is. And it's certainly, as you've heard it called, a novel coronavirus, and it's very novel. It's unlike any virus we've ever seen. So it's certainly a very funky, and the more we see of it, then the odder it is. So it'd be interesting to get into that more in a moment.
we were looking today and just about the number of cases in the United States as compared to everywhere else. And, you know, in North Carolina, we've only had 50,000 cases and a little over 1,200 deaths. But in the United States, we've had 2.3 million cases and 122,000 deaths. So I think the thing that's interesting to me in all of this is that we are only 4% of the world's population, but based on all of the figures coming out, we have about 20% of the COVID cases and the COVID deaths in the world at this point in time.
That's correct, unfortunately. We were poorly prepared, I think, as a lot of people are aware, with both for testing, and certainly we continue to be poorly prepared for contact tracing compared to most other countries, some of whom have done a really impressive job. I think South Korea and Singapore are some of the ones that get a lot of attention. They've had very good success with their contact tracing and testing programs. And there's some helpful information coming out of Germany. They're doing a great job with contact tracing. Vaccine development is aggressively occurring throughout the world. There are over 10 human trials right now on vaccines for this. Because basically until we have good treatment and we have vaccines available, we're not going to be able to control this virus. And everybody's asking about when, is it going to happen again? Basically, the discussions are that a second wave is a when, not an if. What we anticipate is that when the weather cools down again and people are moving back inside where the air is dry and heated, and where again people are clustered together, that's probably when we're likely to see the second wave again. But it's certainly increasing in some areas now because people are understandably tired of the lockdown restrictions and kind of want to pretend that it's not happening. So they like to go back to normal. Unfortunately, in many areas, we are seeing increases in cases. And so really, until we have some better treatments or preventions, then the social distancing is going to be some of our best bets. There's been a lot of discussions about the masks. How helpful is that? And initially, there was not great info. And so the feeling was that the homemade cloth masks probably weren't that helpful. We now actually have some data on that. And while certainly the surgical masks continue to be pretty good, what they call the N95 masks have been the standard. What we're actually finding is that a single layer cloth mask is helpful. It will cut down about 40 to 50% of the virus that's being potentially transmitted. If you have a 2-layer cloth mask, that seems to cut down 94, 95% of the potential spread. since we now know that most of the virus appears to be spreading through respiratory droplets. So there's less concern among many of the infectious disease people about contact on items. So we know the virus can live on certain hard surfaces for up to a couple of days potentially, but what we don't know is, can that virus then infect somebody? We know it's still on a plastic surface 24 to 48 hours later potentially, but that doesn't mean that that virus can infect somebody. We still don't know how much virus it takes to create an infection. There's basically quite a bit that we don't know. But the double layer masks does seem to give a really good protection, almost comparable to the surgical loop masks that many people now are getting access to. So I think that's certainly something that if you're going into situations around other people who are outside of your cluster or cohort, you know, not the people that you're sharing living space with, we would recommend having a mask. That's going to cut your chances down of picking this up. Do you want to jump in with anything yet?
Thanks. Well, I'm going to jump right into the part that I was going to talk about tonight. And I think Dr. DeMocker has just continued to say, you know, it's not, you know, if we're going to have another outbreak, it's just about when. And we've done a lot of things at the school to, we're bringing our students back early, so hopefully they're going to finish their fall semester right before Thanksgiving, because we're hoping if we can get them home during that period of time, that maybe that'll be better for the school. As far as our office, I want to continue to remind you that every night we have a service come in that does a disinfecting procedure throughout every treatment room in our entire clinic. And we continue to leave the reception room closed. We ask that people sit out on the porch until we call you in so we can put you directly in a treatment room. And we've had a real big shift with the college this week, because for the first week, we've finally opened the college clinic up for our students because they need to be getting their patient count. So right now we've got both the Chinese Acupuncture Clinic open and the Taoist Traditions College Clinic. So tonight I was going to look at, you know, something to talk about that had some roots in COVID, but also something that we could look at how to treat it from different modalities and how to work with it at home. And what I decided to choose was the sinus conditions, because one of the things we do know that one symptom that comes about through this is the loss of smell or the loss of taste. In other words, loss of our sensory orifices' ability to sense the world, whether it's through taste or through, you know, our smells. So I'm going to talk a little bit about sinuses tonight. And because of that, the first thing that you need to know that from a Chinese medicine perspective, the stomach meridian starts directly here besides the nostrils, and then it travels up to underneath the eye, down along the jaw, up to the head, and then there's a branch that breaks off and goes all the way down to the second and third toes. And the reason I'm talking about that was in Chinese medicine, we think of heat oftentimes can begin with the stomach, even though the lung and large intestine are the first meridians. So lung and large intestine are a pair. And just as you may have heard me talk about heart and small intestine, or the kidney and urinary bladder, the lung and large intestine show us a lot about sinus congestion. Large intestine 20 is actually this point right beside the nostril. And so that's, you know, large intestine meridian starts down here on the index finger, comes up the arm through the shoulder, and comes right next to the nostril. And whenever you have a sinus problem, it's either because of the lungs and lung heat or lung dampness. So remember, whenever we're looking at pathology from the exterior, we're looking at wind, and you have to remember the Chinese had the wisdom to know that the wind created illness. And here we are talking about the winds that carry the viral particles or the bacterial particles. So they knew it was something carried by the wind. So that's why in Chinese medicine, when we talk about a wind heat condition, we oftentimes could be talking about a bacterial or a viral condition. We also talk about wind damp and heat. And whenever you hear the dampness, then you know, it's like dampness is congealing, it blocks. And so dampness of the sinus blocks the sinus cavities and our ability to experience smell. And so oftentimes, if a patient who has COVID ends up with a sinus, the lack of smell, the loss of smell, we know immediately that their number one root and their problem may be more with the lungs. We've talked about in COVID how sometimes because of the blood clots, that may be someone with lack of circulation, for the qi is not moving blood, and that's the liver qi. So we've talked about how important walking is. Walking is essential. It's what supports the liver, the movement of qi, and the qi supports the movement of blood. And so we know that people who are dying of blood clots, that's related sometimes more to the lung-liver pathway than the lung-large intestine pathway. We know already that there's a large intestine pathway that some people are manifesting with digestive symptomology, diarrhea and nausea and vomiting. So that's the other pathway. And then that last one we know about is the neurological. We talked about the liver, that it goes into the brain but doesn't come out. And so the neurological brain, pathways that basically impact the brain, these are the serious pathways for COVID-19 that sometimes end up taking people's lives. But when we look at the lungs, the sinuses are one of the very first things. So what I'm going to suggest is that I give you some information tonight of what you can do, whether you have chronic sinus congestion or whether right now it's just a preventative. And I've tried to look at different modalities and how they work differently and the strength of each and what you have to have us to do and what you can do on your own. So, the one thing we look at first off is sinus congestion. Usually there's dampness, there's phlegm. And we all know that we sometimes say, oh, I just feel fuzzy-headed, I can't think clearly. In Chinese medicine, we talk about phlegm misting the mind, okay? So phlegm misting the mind. It's not just that phlegm impacts our sinuses, but it missed our mind also. So from our perspective, one of the things that we want to do is say, what can we do to resolve that? And I'm going to talk about acupuncture. I'm going to talk about that really quickly because you're not going to be doing acupuncture, most of you. And for the students who are listening, you should write these points down because one of the things that I have seen over the years is I have never treated someone for sinus pain or a sinus infection that didn't get pretty much immediately results with this treatment. And so there's 8 points that I use right off the bat. And these are points that I usually hook to electrical stim, so you feel the little tapping at the points. And again, there are not too many things that I say, write down these points and use them, because most of the time I'm always going to be assessing the person. But even though I talk about if you come in a diagnosis of gallbladder damp stagnation or lung large intestine stagnation and phlegm, you know, all of these points, there's a combination. So this is the point I said was large intestine 20, okay? Now there's another point, stomach 2 and stomach 3. And what I do is I always palpate and find out where the sensitive point is. And that's where I choose. So I usually say stomach 2.5. There is no such point, but to me it means I found the point somewhere between 2 and 3 that's the most sensitive. Now, the next point that I go to is Weil, and I always make the corny joke, and most people don't laugh at my corny joke, except the reason I choose Weil is it always makes you go yow. See, y'all didn't laugh either, okay? Thanks for laughing, Sharon, I appreciate it. Okay, but Weil is a sensitive point right in the eyebrows, and there's a little notch there. Right over the bone, and so I go into that little notch. And the last point I do is gallbladder 14. So I've chosen a large intestine, a stomach point, an extra point here, and then a gallbladder point. And all of those meridians, large intestine, stomach, and the gallbladder, have to do with phlegm congestion in the sinuses. And so that's all I do. So students, you wrote down the points, and I do electrical stim on it. Everybody gets off the table, the headaches are gone, they have tremendous draining that night after the treatment, and so we get really good results. But that's what we do in the office. I want to tell you about what you can do. The gallbladder point was gallbladder 14. I just saw somebody throw up a question, the students. I think what I'm going to do is talk a little bit, and I'd like to demonstrate on you. And I just remember that I left all my tools down on the table. While I start talking,
Okay.
the coffee table right in front of the couch, it looks like a buffalo horn and a stone and some things. So. And I see someone asked a question about Jade Screen, but I'm going to wait to the end. The first thing I'm going to go ahead and talk about, and I'm going to demonstrate this on Sharon. And these, well, I'm going to demonstrate a couple of things with her. And I have two tools here. And as you can see, this is a water buffalo horn, and this is a green calcite, a stone that we use for massage here. And when we do these points that I'm talking about, I'm going to suggest it's not important for you to have these tools, okay? I have those, so that's going to be better for my friend Sharon. But I'm just going to give you a tweener, a little massage that you can do. If you have a sinus infection, I'm going to tell you to do this 5 times a day. I mean, so every hour and a half, every 2 hours, because that's how much you need to do it to keep you from walking into the office and needing to see us, okay?
So people can just do this with their fingers?
Yep, yep.
Acupressure points?
Yep,
Okay.
just the fingers. So, but today I'm going to demonstrate with the tool, and then Sharon can also do this. But the very first thing we do is we go to large intestine 20 here, and it's 18 circles. So if you were doing it with your hands, you would just put your hands right up here, Sharon, and 18 circles. 1, 2, 3, 4.
Does it matter which
5,
direction?
6. Nope. 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. Okay. Did you get your 18 circles in? Okay, good. So another one that you do is if you put your thumbs right up here on your cheekbone, and then you go up to the bridge of your nose, Okay, and here we're going to stroke down 18 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17. So what we've done is just gone from the bridge of our nose all the way down. And if you used a tool like this, and we'll talk about essential oils in a minute, you could be going here and down. Just come up to the top of the bridge of the nose and stroke down on both sides. Okay, and again, you want to do it, I'm saying 18 times because we want to make sure that you're doing it enough to open up the pressure. Now, the third point that I talked about was the third point I'm going to talk about is, again, you're going to put your thumb up at your cheekbone, and we're going to go back up right above our, right between your eyebrows. And you're going to go stroke across all the way to the hairline. 1, 2, 3, 4.
Doing it slower so people can do it at home there if they want to try this.
Absolutely.
Is this also 18?
18.
Okay.
Chinese medicine, we all do things, we do things in threes. Kind of doesn't matter what the religion is, there's that trinity everywhere, from Christianity to Taoism. There's that number 3 is magic. So basically we do 18, 21, 24.
Does the speed of how fast I do it matter?
I think it's good to do it better, faster, because what we're trying to do is create more friction, and basically even that massage there of opening up above the eyebrows and coming all the way out to the hairline is really important for, you know, the more friction, the better it's going to create a release, okay?
It doesn't matter what order should we start with this one?
I would always start with the one here, right by the side of the nose. Now, the next one, you could do this one. In other words, come right up to over the forehead. And a lot of people know that you get a headache sometimes, a sinus headache, right across here. Now, some people have it down in their cheeks, but you know, this is another way to open up this area if you have a sinus headache. So I'm going to say always start here, and then come up and go ahead and go across here. The next one that you're going to do is, again, just like we did 18 circles here, you're going to come up, and you don't have to find the exact depression that I was talking about. What you're going to do is you're going to feel across your eyebrows and find where the most sensitive part is. And at that point, you're going to do 18 circles again. 1, 2, 3.
Yow.
Yeah, I would say almost everyone who has some sinus congestion is going to really feel that point. There's a lot of sensitivity there. So I think once you've opened those, then I guess the one that I showed you second would be the one I would recommend that you always do that last. And again, it's go to the bridge and draw down, okay? So the first one again, 1. The second one, 2. The third one, yow. And then the fourth one, again, here down to the side of the nose again, just stroking down along the side of the nose. So that's a tween-eye treatment for sinus congestion, okay? There's also a Qigong that's specifically good for sinus infections, Sharon. So, and this is going to be the easiest Qigong that you've ever had. So it doesn't matter whether you're sitting or whether you're standing, okay? But this is a very, very simple Qigong exercise. First of all, we have 2 lymphatic ducts on both sides of our neck. And so one way you're going to do this is you're going to take your eyes and you're going to lead with your eyes and follow and look over your back shoulder, okay? And then you're going to lead to the other side. And as you stretch, feel the stretch up here in your neck. And again, don't jerk, just very slow, but concentrate on feeling the stretch here. Back to center.
So is the idea to go as much as we can to stretch here?
Yep, yep.
Okay.
And then to the other side. Now that you've got going to the side, you're going to breathe in. And as you come back to the front, breathe in through your nose. Exhale through your mouth. In through your nose. Exhale through your mouth. So this is something you also do for 18 times. And this is a type of Qigong. You can do it standing, you can do it sitting. Usually you want to keep both of your feet flat on the floor, whether you're standing or sitting. Now, after you finish that, I'm going to close the window. It's raining really hard here.
It's probably getting kind
And
of
it's
loud
coming
with the
in.
thunder.
It's also, oh, that back door needs to be shut. I can tell it's going to be, it'll be coming in that back door, Sharon. Junie was up there. Okay. It's summer, so we've had all the windows and the doors open. Junie and Sharon both spent the day out here. So, is it raining really hard in Asheville? It is pouring. Here. Okay, so once you finish, oh man, we just realized I'm a mother as of today. I have 7 to 9, we're not sure, baby turkeys in my front yard, and I live on a good deal of acreage, so it's not like a normal front yard for those of you who haven't been out here. But I have a lot of baby turkeys that hatched out today. And so now I'm worried about my baby turkeys because earlier the mother was down in the gully, and if they stay down there, because I have a stream that runs through my front yard whenever it rains really hard like this. So hopefully my baby turkeys will be safe because they just hatched today and they're tiny, tiny, tiny. So back to the Qigong, but my baby turkeys are important. You know, it's been a while since I had babies around my house. So with the Qigong, again, we're going to be breathing in, looking to the right, and stretching out our neck here, feeling that stretch to the other side. After you've done that 18 times, I want you to find your collarbone here, and I want you to tap. And just take 2 fingers and tap above that. Because what we're trying to do is open this pathway. So once we've opened up the neck, that we'll get some drainage, okay? So
just everywhere above the collarbone?
Above the collarbone, and 18 times. 1, 2, 3, 4, 18 times. So now you've learned 2 things. You've learned a twin arm massage, and you've also learned a Qigong. If I were doing them, I would do the Qigong first and get the neck open up and relaxed, and then I would do the twin arm massage. But again, if you're going to do this, you need to do it at least 5 times a day. Okay? So so I showed you for the students who are here, you're already, I've written down those points that I talked about during the treatment. and we've talked about Tuina massage, and we've talked about Qigong. The other thing I'm going to talk about is essential oils. And again, all of this because these are treatments that the patient can do at home, okay? Essential oils are really important for the sensory orifices. And the reason is, you know, our sense of smell goes directly into our limbic system, okay? So it goes directly into the brain. And so it's essential oil treatments are very, very powerful. Now, there's a couple of different essential oils that you could use. And what I'm going to suggest is a combination of Rosalina, Eucalyptus radiata. There's a lot of eucalyptus, okay? So Eucalyptus radiata is one that clears heat more. So Rosalina again, Rosalina, Eucalyptus radiata.
Is that pretty easy to find?
Very easy to find. Yeah. Okay. And raven's hair. And, you know, people always ask me about using the ones from the health food store. And I want to always encourage you, if you've been to my clinic, I'm sure that we've given you essential oils to take internally sometimes. And that might be 1 drop of an essential oil in a little bit of honey or a little bit of lemon water. But, you know, you never want to use any type of essential oils that come from a health food store. The essential oils that we get are usually extracted in Europe, because in Europe, essential oils are considered Western medicine healthcare, okay? Any pharmacy you walk into in Europe is going to have essential oils along with the pharmaceuticals. They will have lavender, they have raven's hair, they have eucalyptus. They will have a whole department of essential oils in our European pharmacies.
But really what you're saying is a lot of the ones that are available would not be taken internally.
Absolutely
unless
not.
They get it from your clinic.
Or unless they get a medical grade. And, you know, you can get by medical grade, but many people will say, oh, they're, you know, you can use them. But then if you ask them, is this medical grade? They are back down really quickly. And the thing that we'll see in the health food stores is it says that they are organically grown, but it doesn't matter if it's organically grown once it's extracted with solvents. And extracting it with solvents, I think Evelyn may have spoke a little bit about this, makes it much less expensive to buy. So the quality of what you see in the health food store may be great for diffusing into your air, but I really encourage people not to even put the ones that you buy in the health food store on your skin, okay?
Right.
So
they should always be diluted if you're going to do that.
Yeah.
At least 10 to 1.
Yeah, for sure. Thank you. So, so those are the main essential oils I can use. Now, the truth is, you could use that formula neat. And when I say neat, that means topically without a carrier, okay? If you're going to be taking them internally, or if we're going to be applying them every day. And I can tell you that probably in the last 30 years, I have treated about probably 6 cases of pertussis, whooping cough. And so basically, those parents are up all night with their children anyway, but there's a formula that we give them that they put on their chest and on their back, and they do it every hour. But that's not neat. In other words, it's not the direct essential oil, it's on a carrier. And because almond oil is good for the lungs, it's usually we'll have for a baby about 20 drops in a 1 ounce bottle of almond oil. And then the parents will be applying those every hour on the hour. And we have gotten the best results with infants with pertussis, or whooping cough, with essential oils. So, but, you know, back to the sinuses here, you can take, and if you just had 1 drop of the essential oils, if you had that a bottle of those 3 and just put 1 drop on a plate and touch it here and then massage. Now, I tell a lot of people, okay, you have to be very careful because the oils that we use, if you get those in your eyes, it's going to burn like the dickens. You're going to cry for 15 minutes and then it's going to stop burning. Okay? It's not going to make you go blind, but it is going to burn like the dickens. And so you wouldn't want to come up this close to your eye. So if you're doing this, I'd only come halfway up your nose here. Now across here, yes, just, it's not like you, that was a loud crack of thunder here. It's not like we're going to come down and have enough that it'll be dripping into our eyes, just a tiny bit.
So would they also use that when they're doing the neck?
You absolutely could do that on the neck tapping too. The same essential oils. So we have, let's see, eucalyptus, radiata, rosalina, and ravensair. You can also use them with the tool. I mean, you could take and just dip in there and then just stroke besides the nose. And sometimes this stone feels really nice and cool. So if you're having a sinus infection, sometimes you just to take a stone because it cools it off rather than our hands are already going to be hot, okay? So that's, that's another important thing. So let's see.
So to recap, they'd want to start with the stretching.
Right.
Then the tapping, which they could do with the essential oils on
Right,
their fingers. Right. And then they would go to the points here and then here.
And go across.
And across to the hairline.
Mm-hmm.
And then
up to the Uyao point.
To that one. Okay. And then to
the last one.
With this.
Yes.
All of that with the oils.
Good,
if they wish.
Yeah.
Okay.
Yeah. And here, then we go into diet. I mean, the truth is, if you have a sinus infection or you do not have any sense of taste or smell, I'm going to tell you right off the bat, and you don't have to do it for life, but for 1 week, eliminate milk, cheese, yogurt, ice cream, sugar, spicy foods, fried foods, wine and beer, okay? That's it.
And when you say milk, I know when I'm telling patients, I'm saying specifically cow milk products.
Yeah.
Because the casein that's in it's only in cow milk, but that's what tends to create more phlegm.
Yeah.
It's not in goat milk. Yeah. It's not in soy or almond or coconut milk.
Right.
It's only cow milk.
Right.
And there are some cheeses that are made with sheep or goat.
Yeah.
And those don't seem to cause problems.
Not nearly as much. It's mostly those hard cheeses, the soft cheeses, feta, the particularly feta from sheep or goat is if you're going to have any. And pretty much I tell people, just take it out for a week. Now, some people are asking me, well, what can I eat or drink? And anytime you have an infection, to basically take something that's really cleansing to the body. And everybody here now hears about green drinks, okay? Everybody hears that. And so the first thing I ask a patient is, well, what's in your green drink? And they start saying, well, then they greens, and then this, and then that, and then maybe a carrot and half of an apple. The minute you throw a carrot and a half of an apple into a green drink, it is no longer a cleansing drink because there's too much sugar in it. Carrots and apples, if you want to do something that's specifically cleansing, get kale, chard, arugula, and celery, okay? And, juice those and then put half of a lemon in it, okay? That's really cleansing. So drink that twice a day if you can do that. Where can you find a green stone? This again is green calcite, and they have these tools probably in the stone stores here. I got them when I was in Tucson at a gem show. So, but a lot of the stuff in the stores here is, you know, pretty expensive, but I would bet that this would be about $20 there.
So they could probably find it online.
Oh, definitely you could find this online.
Mm-hmm.
I never think about online.
Mm-hmm.
Okay.
So they're just looking for something that's called greenstone.
Yeah. You know, and, you know, we talk about guasa spoons, and those are the little Chinese spoons made out of ceramics, where you have the spoon in, which is similar to this. So if I were doing guasa on Sharon, say she had a lot of congestion and sore throat, and I had an essential oil, and I was scraping here gently to open this up, you could do the same thing with one of those Chinese spoons, and the end of it is just like this, that you could do that. You can buy those pretty much anywhere in a lot of places here in town for like $1.25, okay? But the stones are sweeter though. But, you know, Chinese soup spoon or a water buffalo horn. And I used to be able to get these every time I went to China, like really cheap for like $1. And like everything else in China now, it's almost as more expensive there than it is if I can find them here. But it's just a water buffalo horn, as you can see. And they don't have to kill the water buffalo to get it, and water buffaloes don't fight. So, you know, and they don't take it from the very edge. So I'm trying to tell you that they're not hurting the water buffalo. So let's see. This stone is calcite. I said green calcite. Calcite clears heat. So this is a particularly good stone if Sharon had a sinus infection with a fever. You know, I might also, you all have heard about large intestine 4, and we all know that massaging this point here. But because it's calcite, it also helps to clear heat. And you can feel the coolness of the stone. And the large intestine meridian, again, the lung meridian starts up on the chest, comes down into the thumb. And then it hooks up to the large intestine meridian. It starts here and goes up and ends here. But, you know, there's a real important part here, large intestine 11. Let's see if we can get your elbow up here so I can show them. And it's right here at the end of the wrist, not the wrist, what is that? The elbow crease. It's these big fancy words, elbow and wrist, that get hard for me. So again, just taking and massaging a little bit on the points. And, you know, these are all really good things to be doing. And again, do this all the time. Do it, you know, two or three times a week, even if you don't have sinus infections, because in Chinese medicine, we now, well, Western medicine is beginning to see that people who have blocked sensory orifices and a less of the ability to smell also have higher rates of dementia. So start working on that now. You have the ability to change that yourself. You don't have to come in and see us. What you can do is really important. I want to talk about one more thing and then we'll stop. Jade Screen. Jade Screen is 3 herbs. Fong Fing is to open the surface, and it's the surface of the skin, in other words. So basically, if you took high amounts of this herb, it's called Sila, it would cause you to sweat, okay? The other herbs are astragalus, which everybody hears about, and Baiju, atractylodes, which nourishes the spleen. And the spleen and the lungs are our postnatal chi. The air we breathe, the food we eat is what builds our chi. And so if we know postnatal chi, what can we do to take care of ourselves? Spend a good period of time every day breathing deep, feeling your lungs open up. And the other thing is eating foods that nourish us. So this formula, Jade Screen, helps to balance out their immune system. And so that's the herb that I've told people to all take during this time when you're trying to protect yourself from anything from the external, viral or bacteria. And we have our patients taking it. For those of you who basically donated some money for the homeless, we took over, I think, about 240 bottles to Haywood Community Church that gave them out to the people there who are maybe seeking care from them or food from them because of not having the resources all of us have. And I think, do y'all have any questions for either Sharon or myself before we end today?
Well, and I think that's great that you've brought up the diet, because that's certainly something that I'm always talking about patients with too. Because as you mentioned, we're seeing about 30% of the people are having GI symptoms.
Mm-hmm.
It's more prominent in the elderly.
Yeah.
And they not only are having GI symptoms, typically diarrhea and stomach upset, but they also are shedding the virus through the GI tract for up to 3 weeks or possibly longer.
Okay.
And so that is certainly a significant concern. There's many people are aware that there's more and more talk about probiotics, prebiotics, things that help to kind of keep the gut in good shape. But I think, as you mentioned, some of the things that are good to try as well as to avoid. We know that things that trigger more inflammation are a problem in general with disease, but specifically with COVID. And so the people in general that are not doing as well, or that are more likely to have the serious problems, are people that already have a lot of inflammation in their system. That's diabetics, because the sugar tends to trigger a lot of inflammation. So I think all of the things that you were talking about that can help to decrease inflammation is going to decrease people's risk also.
Right. Good. Okay. I've got one more thing I have to tell you. So I don't know if my friend Mona is on today because she was in a class all day, but for those of you who don't know, I tore my lateral meniscus on my left knee this last week. And as of Wednesday of this last week, I couldn't put one iota of weight on it. I have crutches and a walker, and I missed work last week and I'll stay out this week because my job is to get that better. But I have to tell you what we've done. And my good friend, Dr. DeMocker here, has been right with me as we did this. I was told to get 3 stones. One of them was blue apatite, okay? The other one was garnets. And then the third one was fluorite. And basically, we crushed those up first, and then we put them in a grinder, and we made a powder, okay? And because the thing to remember is stones are all made of minerals, and minerals help our body to heal. So then I took 2 essential oils. There's an essential oil called Duho that I put in with it, and the other one is frankincense, because frankincense helps to heal wounds. So then I took that, and then we slathered it all over my knee. And Dr. DeMocker did a great job of taking the saran wrap and wrapping up my knee so it stayed on for like 24 hours. And, you know, it's Sunday, and now I'm able to put weight on my knee. And, you know, we're doing all of these things that, you know, I'm always telling everybody else to do. And since I tore my meniscus tendon on the left knee, I'm doing them too. And my friend Sharon's here helping to tell me, don't go down those stairs again and everything else. So,
do we have any other questions? Flashes here.
Let's see. Thanking Jeannie for the list. It's a great. Oh, Jeannie. Jeannie. Where can you find greenstone? Sharon answered that. So if there's no other questions, I guess we will sign off. Thank you for joining us. 2 weeks from now, we'll do another one, and I'll try to pick a topic that has connection to COVID. And I'll try to tell Sharon to come back or be here. So, because it's always nice to have someone else to talk with while you're demonstrating things. So thank you. And it's nice to see everybody. I hope y'all have a blessed week.
Stay safe, stay healthy.
Bye-bye.